Good evening, everyone. My name is Alyssa Scarciotti. I'm the Clinical Education Manager here at Lexier Dental Laboratory Group. We appreciate you joining us this evening. We have this presentation specifically for our partners at DCA Dental Care Alliance. So we're excited to present this exclusive webinar for your group. Emily, if you can just go to the next slide. Just a couple little housekeeping items. We encourage questions. We have a smaller size group this evening, so in the Q&A section of Zoom, please enter any questions throughout the presentation. Emily will be happy to pause and answer any questions that you have. In terms of CE credits, you all will be receiving one CE credit through Lexier, through AGD PACE. We do track the attendees, so in order to be eligible for your credits, we do need you to be present for the duration of the webinar, and that's just for us to stay compliant with AGD PACE. And then we will be sending out your credits within 2 weeks from education@lexier.com, probably sooner, but if you don't hear from us within a couple weeks, you can check back in. And then I'll pass it over to Lauren Crow for a quick introduction.
Thank you, Alyssa. I appreciate all you've done to get this together. Again, my name is Lauren Crow. I am one of the Director of Corporate Accounts for Lexier, and I am the dedicated Corporate Account Director for DCA. So my job every day is taking care of great customers like those of you that are a part of the DCA group. We're really excited to be able to put this on for you all, and I hope that it's really educational and it's motivating for you guys to try us out for digitally printed dentures. A little bit about Lexier, if you're not familiar, we are a group of labs domestically and offshore. So we have somewhat of a hybrid model. These are a list of our domestic labs. The 4 that we are contracted with DCA are going to be our 4 domestic labs. So which are going to be Precision Craft out of Rhode Island, York and Connecticut, Thompson Suburban, which is in Maryland, and Knight Dental, which is in the Tampa, Florida area. And that's home to the CAC, where your aesthetic cases can be fabricated. It's also the location where our digitally printed dentures are printed. So we provide support in a lot of ways to all of our customers, including DCA. So we do hands-on training and in-person, where we can come into the office, do one-on-one training with with some of team members, or do an office training like Jan's doing in the photo below, where she's doing a presentation with an iTero scanner. And we can go over it with your staff, or we can do it in a group setting where if there's multiple offices, together, we can do it as well. Then we also do webinar style education like we're doing tonight, where if it's, on a certain topic or a variety of topics or lunch and learn, we're able to provide it in a virtual setting, whether it be, a group, region, or for an individual office. And then we also do group training events. So happy hours, team meetings. We've done sip and scans. We've done regional trainings as well as nationwide meetings. All right, so I'm going to pass it off to Emily, our amazing webinar host for the night. Again, like Alyssa says, if you have any questions, drop them in the chat. We'll be quick to answer them and have Emily answer them as well. But we're really looking forward tonight, and thank you for joining us on this Tuesday evening.
Thank you so much, Lauren. Thank you, Alyssa. Hi, everybody. Thank you for joining us this evening. It's great to have you. My name is Emily. I'm the Director for Digital Adoption and Integration here at Lexier, and I'm excited to talk to you tonight about digital dentures. On the agenda tonight, we're going to be talking, first we'll kick it off about, I'm just going to go over some benefits of digital versus traditional dentures. If you're not familiar, I'll touch on the materials that we utilize here at the Lexier. We'll then discuss a checklist, lab requirements to make your cases successful. And then we'll get into the meat of the presentation, which is going to be the workflows. So we're going to get down to a little bit of a granular level. I'm going to probably repeat myself a few times, but your prescription, that's where it all starts, and communication with the lab is really important to, the success of your cases for your patients. So we're going to talk about immediate denture workflow, new dentures for those patients that come into your office with no existing denture. And then we're going to get into the really fun workflows, which is the copy dentures and reference denture workflows, which is going to help you get to those two visit dentures. Then we'll talk about preparing to scan, tips for edentulous scanning and scanning dentures to help you be successful. And then we'll talk through a demo scan that I did. And I'm going to talk through the proper workflow and scan strategy, which is really, really key to being successful with these cases. And then we will wrap up with some review of some denture scans that we've received here at Lexier, just to kind of talk through what to look for, what's a good scan, what's maybe more manageable, and then what is going to be really considered a rescan, so that you can kind of evaluate that at the office level before sending that over to us at the lab. All right, we're going to have a few poll questions sprinkled throughout the evening here. So we're going to, in 1 second, get our first poll question. Let's see. This is fully anonymous, so no one will know what your answers are, but this is just, have you scanned digital dentures before? So nothing to be shy about answering this question. All right. Some yeses, some nos.
We'll wrap it up and then I'll share the results.
Thank you. All right, perfect. So 2 out of the 6 yes, 4 out of the 6 no. So awesome. So hopefully those of you that have done digital dentures before, maybe you'll take 1 or 2 nuggets of information tonight, if you've been doing this for a little while. And if you have any tips or tricks of your own that, as you've seen be successful, please certainly share. All right, I'm gonna go on in there. Okay, let's see. There we go. Okay. So again, I'm just going to touch on the benefits and some of the materials that we utilize here at Lexier. We do have some other webinars and pre-recordings if you are interested in learning a little bit more in-depth information. But we don't have enough time tonight, so I apologize. But if you do have a specific question, certainly feel free to drop them in the Q&A. So benefits of digital printed dentures versus your acrylic dentures that have been around for obviously, very long time, over 80 years. We have been seeing a lot better fit with digitally printed dentures. They're more durable and stronger than your acrylic materials. You're not seeing any more wax try-ins. So the try-ins when you're doing the printed workflow is going to be a monolithic try-in versus a wax try-in. We can cut these appointments down. So instead of it being 4 or 5 visit appointment, length for the process for your traditional, we can get this down to as little as 2 appointments, which is fantastic. No more single tooth repairs because the teeth are printed in sections or as a full roundhouse, which is nice, and it increases the strength of your denture by doing that. And we have digital design of the teeth. So you can actually request a smile design or a digital mock-up to see the design of the denture prior to delivery or printing that final denture, which we'll discuss here tonight. So a lot of benefits to the digitally printed dentures. There's a lot of new printers on the market, resins on the market. So I just want to highlight again, do your research. But here at Lexier, I just want to highlight, we do utilize the carbon printers. And we're utilizing the Lucitone digital print material from Dentsply Sirona. We do print these dentures at Thompson Suburban Dental Lab in Maryland and Knight Dental Lab in Florida. And again, as I mentioned, you're going to be getting a monolithic try-in, like you can see in this photo here. So there's no more wax. So in the hot summer days, you're not going to have the teeth falling out of the wax, which is really great. If you do request, so one big question that I get a lot is, well, how's the patient going to know, what their tooth shade is? So for whatever tooth shade you put on your prescription, so if you put A2, that's the shade that we're going to be printing the monolithic try-in in. And then you can take, I know it's hard with not being able to see the pink, but you can take like a pink Sharpie or wax if you'd like to, just to help the patient see that there on the try-in. So again, we use the Lucitone digital print material. We do have 3 different tier options, which I like to highlight because you do want to know the differences and make sure that you request in your prescription if you would like a standard, premium, or elite. So for the base material for all 3 tiers is the Lucitone digital print material. The main difference between your standard and premium is the tooth material. So we utilize the Lucitone value tooth resin in the standard and the Lucitone IPN premium material in the premium and the elite. And then as you go up the tiers, you'll have more gingival characterization. So the standards look a little bit more smooth. You'll have more festooning in the premium. And then the elite option, you'll have a lot more festooning, stippling. You have an option to upgrade to milled multi-layer PMMA tooth. We can do custom coloring and shading. Which is really nice as well. So we have the different options there. With the standard, you do have less tooth shades available as well. So we have A1, A2, A3, B1, and then 1 bleach shade as well. So if you do select a premium tooth shade, that would bump you up to that premium option if that tooth shade's not offered in the standard. For all 3 options, we do have a 5-year warranty, and we also store the file for 7 years, which I think is really, really nice for those patients. You know, maybe they've been admitted to the hospital and the hospital loses their denture, or, you know, we had a case come in, the grandson flushed the denture down the toilet. So anything can happen. So with having a digital printed denture, we keep that design file so we can have you a new denture within just a few days. For that patient, which is really great. All right, so helpful checklist. So you can find this on our website too. I'd highly recommend you check out our website. You know, if you're new to digital dentures, this is a nice checklist. So everything the lab needs is on this PDF, and you can get this again on our website as well. So photos are very, very helpful for our technicians when they're just doing the designs. And definitely if you're asking for a smile design or a digital mock-up. So the photos that are really helpful, if you can send a full face smiling, full face lips at rest, profile, and then a retracted and occlusion, that's fantastic. If you aren't familiar with the attachments feature that iTero has recently updated, you can actually add the photos on myitero.com to the RX, and you can send us the scans and photos at the same time now, which is really great. We also need a detailed RX. The more information you give us, the better. So what type of digital printed denture, also specifying that you do want a digital printed denture, because we can still go that analog or acrylic route, you know, depending. So definitely specifying so we're giving you the correct material that you want. Again, the 3-tiered option, so standard, premium, or elite. So letting us know premium digital printed denture. Then we want to put the stage. So are we going, you know, do we need to do a bite rim? Are we going to go straight to finish final? You want to let us know which stage we're going to. That is really, really helpful. If you'd like to provide us the mold, you can, but you don't have to. That is not a requirement. Especially obviously if we're doing like a copy denture workflow, we're going to be copying the denture as is, so you wouldn't be putting a mold for that. We do definitely need to know the tooth shade and gingival shade always. You'd be surprised as to how many prescriptions come in with a missing shade. So providing the shade is helpful. And then any additional notes, you know, if we're increasing the BDO by 3 millimeters, 2 millimeters, we'll get into that a little bit more here. But, you know, if we need to fix a cant or shift the midline, you know, all those things need to be notated in your notes of your prescription. And then obviously we need a full scan. So we need an upper, a lower, and a bite if we're able to. If we're scanning the edentulous arches, you would just scan the upper and the lower and skip that bite segment. But when you do scan those edentulous arches or partially edentulous arches, and maybe we're doing an immediate complete denture, just be mindful that to evaluate your scan, because we need to make sure that we have a full palate, all the vestibular areas, you know, all that critical anatomy that to make a successful denture that's going to be well fitting for your patient. All right, so again, we're going to go through the RX first, how to chart for each of these workflows. So it's going to be a little bit granular for a second. And I probably will repeat myself a few times, so bear with me. But again, it all starts with the RX, and communication to the lab is very, very important. So immediate denture workflow, nothing crazy here for this workflow. But so we're going to go through, again, we're focusing on iTero tonight. So denture removable, if you're not familiar, or haven't utilized denture removable yet, this is a somewhat newer drop down that iTero has added. So if you're familiar or have heard of the AI or auto cleanup that iTero has, so all other procedure types have this enabled. So if you capture the tongue or your finger, cheek, what have you, it's going to automatically delete that out because it knows it's not supposed to be there. It will also clean up so that you have only 3 to 4 millimeters of tissue. So that is very key, because if that is enabled, you're not going to be able to scan those, partially edentulous spaces or that full edentulous arch. So when you select and scan under denture removable, that auto cleanup is automatically disabled. So you don't have to worry about changing any settings or anything like that. So we're going to select denture removable. Our type is going to be a full immediate denture. You're going to select your stage mold if you'd like to. We're going to put our shade, tooth shade and gingival shade, and then we're going to select upper denture, lower denture, or both, okay, depending on the case. All right, so typically 2 to 3 appointments for your immediate denture. Again, this information can be found on our website as well. So first appointment, you're going to scan both upper and lower arches with the bite. Now, I say 2 to 3 appointments because, some cases you still have to do a wax rim. If that patient is very unstable and they're, have a collapsed bite, we still need to establish that vertical. So that would essentially add that extra appointment. So just keeping that in mind. If they're stable, but they're collapsed, you can increase their vertical, take your measurements. If you use, bite registration material, you just have to notate to the lab. Or the other option you have is if it's 2 millimeters or less that we're increasing the VDO, you can just notate that in your notes section of your prescription, and the lab can do that. If it's more than 2 millimeters, you have to manually do that or do a wax rim, okay? If it's an immediate denture, let's say patient had a partial, you can send us, if you're familiar with the denture copy scan option, we'll talk through that here shortly. That's going to give you an additional scan segment. So you could actually scan with the partials in place so that we have the correct vertical. And then you can scan with the partials out. So you'll scan those partially edentulous arches, upper and lower. So a couple different options there. Obviously, every patient's different, but pretty straightforward with your immediate denture workflow. Next, we're going to talk through the conventional or new denture workflow. So these are the patients that come into your office. They have no existing denture. So we will still scan, fill out our RX. Procedure type is going to be denture removable. Instead of full immediate denture, we're going to select full denture tissue based. And then we're still going to do a bite rim for these cases. Typically, there's going to be 2 options I'm going to talk about, but majority of what we see, we're going to bite rim. And then when you send that wax rim back, or you can try to scan it, at that point, we can then move it into the digital workflow, and you can still get a printed try-in, that monolithic try-in, and a printed final denture versus your acrylic. Okay. So we'll select our stage there. This is what that's going to look like. So again, 2 options. Majority, we see option 1, but if you're comfortable doing option 2, you can certainly do that. So again, option 1, we're going to just scan that upper edentulous arch, lower edentulous arch. We're requesting our bite rims, and we're going to send those back, and you're going to establish your VDO. You're going to mark your smile line, midline, canine line, all of those things. Okay. Certain principles still apply. So option 2, though, if you're able and comfortable to establish the VDO with like a putty matrix, you can certainly do that. So you're going to set your VDO, let the putty set. Once that's set, we're going to have to trim either in, 3 sections or in half. And then what you're going to have to do is, once you have the upper and lower scanned, we're going to place the putty back in the patient's mouth, and we're going to place it contralateral to the side that we're scanning. So if I'm scanning the right side, I'm going to place my putty and set that patient's bite on the left side. Okay, so the scanner needs to have enough reference points. This can be challenging because if the scanner doesn't have enough reference points, then the arches might not come together. And also if you do this method, please send photos. It's very, very helpful. So we still need to see where the smile line, midline, so you can mark that on your putty, take the photos, and send those along with the scan to the lab. Again, I don't see this option done very often, but if you do, it certainly can be done. I've seen it done. You just need to notate that you actually established the VDO so that we know the putty's there, and also send those pictures. Very, very important, because otherwise we just get scans and the arches are floating in space and we're trying to guess if they're actually articulated or not. Sometimes it can be a little challenging to tell. So notating that is great. So that would be appointment 1. Appointment 2 is going to be, let's say we send you the wax rims. That's the most common workflow right now that we're seeing. This is a nice scan of wax rims. So it definitely can be done. It's not the easiest thing to do. I'm not going to lie to you, but it can be done. So you would follow the same denture scan strategy. You would scan the upper wax rim. You're going to use the base plate, and you can still do like a wash or final impression, which is helpful because that try-in will fit a lot better. And then you'll scan the lower, and then you would place the wax rim back in and scan the bite. Okay, you can see there's additional markings on the wax here. So the more topography you can create, the better. The scanner will pick that up a lot better. Again, it can be challenging because the wax will continue to get on the tip here. And so keep a wet and dry 2x2 very, very close. Sometimes you have to just change the tip out altogether if there's too much wax that's getting on the scanner tip there. So just keep that in mind. It can be challenging. If you're having a tough time scanning it, or you don't even want to try, that's completely fine. You can send the wax rims back to the lab and we will digitize them for you. Key here is that you have to specify on your prescription that next stage is going to be a monolithic try-in, not a wax try-in. Okay, that's really key because again, we're still doing analog and acrylic dentures, so it can be a little challenging for the lab when we get these cases back. If you're not specifying, then this will go into an analog route. So if you put in your prescription that you'd like a monolithic try-in, then you'll get a monolithic printed try-in, and we'll be converting that to the digital route. Okay, and then appointment 3, you'll be getting that try-in back. You're going to evaluate the try-in, VDO, midline, cant, anything that you need adjusted, you'll notate to the lab. If the try-in's not fitting well, you can do another wash impression with medium or light body. You can use acrylic burr. You can grind that down. You can reset the bite if we need to. Make all those changes, and then you're going to scan that try-in 360. You're going to scan the opposing and bite and send that back to the lab, and you'll notate any adjustments that need to be made. Okay, if any. All right, and then appointment 4 is hopefully delivering that final denture. If you want to do another try-in, you certainly can. If you're maybe only making very minimal changes to the try-in and you want that smile design, you just have to request that in the notes. And we'll send that to you, and then you can go to finish from there. Okay. I'm going to pause for a second before I get into the copy and reference denture workflow. Alyssa or Lauren, any questions at all?
Nothing that's come in. No questions as of yet.
All right. I hope that was clear. If it wasn't, totally feel free to drop a question in the Q&A.
It made sense to me.
Perfect. Well, thank you.
And we will share the presentation with everyone at the end. So you'll
Yes.
get to review this again.
Yes. Definitely. All right, so now we're going to get into the fun workflows. So copy denture first, and then we'll talk about reference. So for your copy denture workflow, this is going to be the patient that comes into your office and they have an existing denture. They love the way it looks and they just want another one, or everything's perfect about that external surface and maybe just the fit is off a little bit. So think of it kind of like a reline. We're not going to be changing anything about the external surface if you request a copy denture. Okay, we would only be improving the fit and keeping everything on that external surface the same. So again, prescription, you're going to select denture removable. We're going to do full denture tissue based. We're going to select stage. Typically for copy denture, majority of the times I'm seeing we're going right to finish final, but ultimately it's up to you. If you'd like to do a try-in, you can, but we're not changing anything except for improving the fit. So again, majority of these cases are going to finish final. We're going to need that tooth shade and gingival shade. We're not going to select a mold because again, we're copying that denture as is, and not changing anything about the tooth shape. And then you're going to toggle over upper denture, lower denture, or both. All right. So this workflow is really truly essentially your two appointments. We're going to do a wash impression, medium body or light body, works well. You're going to scan the denture 360, and we're going to talk through in the demo on how to do that efficiently and well. It's really key to have that denture scan 360. We need the external and the internal surface, especially the intaglio. We can't be missing any data there. So we're gonna talk through how to get a really successful scan that the lab can utilize. You'll scan the opposing and then you'll scan that bite. If it's like this photo here and they are just, they have upper and lower dentures, still put that denture back in the patient's mouth when you're scanning the bite. And then the patient can go home with that denture. So you're gonna just take that medium body, light body out, send the patient home with their dentures. And then appointment 2 is going to be delivering their final dentures. Okay, so pretty straightforward there. Again, copy denture is only is not changing anything about the external surface. Reference denture workflow, we're going to reference what works for the patient's denture and change what doesn't. So this workflow we're going to be changing. So this can be 2 to 3 appointments. Again, we're going to select denture removable. We're going to select full denture tissue based. We're going to put stage, mold if you'd like to. Upper, lower denture, both, tooth shade, gingival shade, and then we have this denture copy scan option. So I'm going to highlight this here, but this could be used for a variety of reasons. Denture copy scan can be a little bit misleading because what I have heard and have been questioned on is, you know, a lot of offices think, excuse me, if I toggle over denture copy scan, that means that I'm requesting a copy denture from the lab, but that is not the case. So I just want to be very clear for the denture copy scan. It is only giving you an extra scan segment. Excuse me. It is only giving you an extra scan segment. So think of it as like a pre-treatment scan if you're doing a fixed restorative case. This will allow you to scan the edentulous arch if you need to. So if we're scanning for a reference denture, let's say the patient has a really high palate. When we go to scan the intaglio surface, it's typically very hard to capture this anterior region because the scanners only have about 13 to 15 millimeter focal depth. So sometimes it's just going to be nearly impossible. So we're going to scan the denture 360 the best we can. And then we'll have let's say it's an upper denture. We're going to have upper 1 and upper 2. Upper 1, we will scan that denture 360. We'll scan the opposing, scan the bite. And then in upper 2, we're going to scan the edentulous arch. So some offices I work with, it's protocol. They will scan the denture 360. They will scan the edentulous arch every case. Some are going to do case by case. So again, prime example would be if that patient comes in and they have a very high palate and very narrow arch. Well, I'm going to toggle that denture copy scan over because I know I'm probably not going to be able to capture everything well when I scan that denture 360. The reason for having your edentulous arch scan as well when we're missing data is then the lab doesn't have to guess and you try to fill in that, missing data, and then you're frustrated because you're going to get the try-in or the final back and you're going to have a lot of adjustments, or the denture might not fit entirely. So when we have that edentulous arch scan, we can take our denture scan and we can take the edentulous arch and we can overlay those scans so that we can fill that missing information in with accurate data. So that would be one reason to use your denture copy scan, or how I was talking about the immediate dentures. If that patient, let's say, has partials that they wear, because they are missing quite a few teeth, well, I'm going to toggle over denture copy scan. And then what I would do is, let's say we're doing upper and lower immediate dentures. I'm going to scan the upper arch with the partial in place. I'm going to scan the lower arch with the partial in place. Then I'll scan the bite. And then when I scan in upper 2 and lower 2, that'll be the upper and lower arches without the partial in place. So I hope that makes sense. I just wanted to clarify that denture copy scan option. Again, think of it as a pre-treatment scan option. It's giving you an extra scan segment. That's what that's going to be used for. So for reference workflows, sometimes you have to use it, sometimes you don't. Same with copy, really. If that patient has a high palate and we need that edentulous arch, then that's when you're going to select that. Ultimately, if you can get a perfect 360 scan of the denture, then that's what the lab is going to work off of. Okay. Feel free to add any questions if anyone has anything. I'm happy to stop. If not, I'll keep on going. All right. So reference denture workflow, again, 2 to 3 appointments. Appointment 1, we're going to evaluate that existing denture that the patient has. They know exactly what they like. They know exactly what they don't like and what we need to fix. So we're going to notate all of that to the lab of what we're going to be changing about this denture. We're going to take a light or medium body wash, typically medium body. But if there's not too much resorption and the denture fits, somewhat well, light body. Also, I would like to make a comment that you have to be mindful with how much material you are utilizing. Use a regular set, not a fast set, because depending on the material, how much is there, it can increase their vertical. So if you're not trying to change the VDO, make sure you check where you're at before and after you take that wash impression or that final impression. Okay. If you need to border mold, typically I see doctors using heavy body. Some use compound, majority use heavy body, and then they do that medium body final impression. Then you'll take once you have your final impression, you're going to take a 360 scan of that denture outside of the mouth. Okay. Then we'll scan the opposing arch. Again, we're going to place that denture back in the patient's mouth and scan the bite. Also, I'm going to backtrack for 1 second. After we take that wash impression, again, the custom tray, you're thinking of this patient's denture. It's the perfect custom tray and try-in. And again, we're just notating what they like and don't like. But after you do take that wash impression, just make sure that you do trim up any excess material on the buccal surfaces, or if there's any material that's, coming over the occlusal surfaces that could potentially interfere with the bite. Just make sure you take a scalpel and trim that up. And I'll show you a scan as to why we need to do that towards the end here. All right, so final impression, scan the denture 360 outside the mouth, scan the opposing, reinsert the denture and scan the bite. And then appointment 2 is going to be delivering that monolithic try-in and evaluating if there needs to be any changes made. This picture on the right here is really nice. So you can use a Sharpie, you can notate if that lateral we need to rotate, we need to shift the midline, all those things, and then take photos as needed. And then we're going to, again, scan that back to the lab. I do recommend just scan it 360, scan opposing and bite again. And definitely if there's changes being made. And then appointment 3 would be delivering that final. Now, if we're not making significant changes, then you could potentially have this be a 2 appointment denture as well. So if we're just shifting the midline, and improving the fit of the denture, then that's not really, we're not making too many changes there. So maybe you're comfortable going straight to final. It's completely up to you, but if we are changing a lot about the denture, we do recommend doing a try-in first. So again, up to you. All right, next poll question. Give me a minute. Sorry, I'm coughing here.
That's my cue. Okay. The next poll question, Emily gave you a little bit of a hint on this one.
I know, how many times did I say it?
I'll read this for you. So the primary difference between a copy denture and a reference denture is that a reference denture involves modifying the external surface of the denture.
And again, these are anonymous. And hopefully I didn't put too many people to sleep.
Give it a few more seconds. Okay, we'll wrap that up and I'll share the results.
Perfect. So primary difference between copy denture and reference denture is that a reference denture involves modifying the external surface of the denture. Great job. So that is true. So again, copy denture, we're not changing anything about the teeth, lengthening incisal edges, shifting midlines. None of that's going to happen with a copy denture. A reference denture is going to be your workflow for when we're talking about making those significant changes. Nice job. All right. Let's see. Okay. So we kind of talked through the workflow. We focused on the prescriptions. We talked through what each appointment's going to look like. Here's just a nice brochure. Again, you can access all of this on our website as well. I'm sure nobody's going to remember everything go over tonight. So we try to make it easy, and it's on our website too that you can reference. So again, each of these workflow, we'll provide this to you, and there'll be a follow-up email that you guys can have and share back with your offices as well. Okay, real quick. Sorry, last poll question. All right. Can the lab proceed with this case to fabricate a monolithic try-in? Okay, so this is an upper and lower edentulous arch. There's no notes about a putty matrix. There's no photos. Nice job.
Wrap this up and share.
Thanks. All right, so perfect. Yep, we cannot proceed to a monolithic try-in from here if you did not establish the vertical. So very nice job. Yes, we would need wax rooms for this case. And then from there, we could go to a monolithic try-in. All right. Every time we do a poll, it like doesn't let me keep going on. All right. Okay, so now we talked through the RXs, we talked through the workflow. Now let's talk about scanning. So preparing to scan. So these are just a few tips I always go over no matter what you're scanning for. This is best practice. So we want to turn off any overhead lighting. You don't need any additional lighting when you are scanning. So no loop lights, no chair lights. And one tip that we're going to talk about is if you're able to turn the ceiling lights off in your office, in your operatory, then that's even better because it does help minimize that reflection when you're scanning the edentulous tissue or you're scanning that denture 360. That can really help. When we're scanning intraorally, I always like to sit in the 12 o'clock position behind the patient, have them laying all the way back in the supine position. Don't kill your back and your neck. Have that scanner in front of you, be in good position, and be comfortable when you're scanning. Again, I just like to touch on this because, and that can be applied for all workflows that you're scanning for: crown and bridge, implants, edentulous, all of it. All right, so now specific tips and tricks for edentulous and denture scanning. So as with any scan, we want to try to have it, the denture or the tissue as dry as possible, again, to minimize that reflection. The reflection on the dentures and the tissue is not going to help anything. So keep a 2x2 gauze close by, or air syringe, whatever you like to use, and keep your environment nice and dry. Next, Thompson stick. So When edentulous scanning first kind of came out, there was a theory that, oh, the Thompson stick, the scanner looking for color, and well, time went on, we realized that not really. The iTero scanner specifically is looking for anatomy. So you need to use anatomy to your advantage. So if a patient had a recent extraction site, any rugae, bony protrusions, things like that, use that to your advantage. But you can still use a Thompson stick. So when you're scanning that soft tissue, you can kind of get lost in the tissue. So just using a Thompson stick, it can help slow you down and kind of recognize where you're at in the mouth as you're scanning. And you do need to scan very slow. So not bad to use a Thompson stick, but the scanner's not really looking for color. Again, it's looking for that topography. Turning the wand on and off between segments. So when we're scanning, and I'll kind of talk through this a little bit more as well, there's specific times when you want to turn the wand off. So when let's say we're scanning the denture, we're scanning the external side, I don't want to scan occlusal and then turn it off and then come back and turn it back on. If I need to reposition my hands at all, and again, I'm going to talk through this with the demo, I'm leaving the scanner on and I'm just coming away from the denture with the wand still on, and then coming back after I reposition and continuing to scan. It'll cause a lot of stitching issues, and it can cause some distortions when the scans come through to the lab. So just try not to turn it on and off and on and off and on and off. I'll talk through when specifically to turn the scanner off when you're scanning, that denture 360, for example. When scanning the denture 360, this is really key. If you've ever tried scanning a denture, it can be very frustrating. So key is holding the denture in the same orientation. And holding it still. I don't want to be moving. I don't want to be holding my scanner, right? Like this. I want to be holding, it's hard to say there. And then just moving the denture all around, okay? I don't want to be doing this and moving my denture all around. I want it to stay as still as I can, and I want to move the scanner around the denture. If you keep changing the orientation of the denture, you're going to it's not going to stitch right at all. It's going to be very, very frustrating. And sometimes just having somebody else, like if you're having those issues, and it's not stitching right, and it's all fragmented, have somebody watch you. When I first started learning how to scan, I didn't even realize I was moving the denture around. So sometimes you don't even know it. So having somebody else watch you and kind of point out and give you some tips, that can be helpful too. We talked about prominent anatomy, using that as a reference point. If the scanner starts to lose you, choose that reference point and come back to it. So just like when we're scanning, let's say a full arch, occlusal is kind of our roadmap. Anywhere we've previously scanned, we're going to go back to that area, let it pick us up and go back. Same thing. You want to use that prominent anatomy as your reference point. Next, we talked about turning off all the operatory lights, and minimizing that reflection. Sometimes we'll share with you as well. If you haven't seen the iTero scan PDFs, they're really great, and I highly recommend following them. So for the edentulous arches, when you're scanning, sometimes, especially on the mandible, just scanning from the lingual and buccal sides, to try to capture that alveolar ridge is really helpful. And instead of coming right directly on the occlusal, you want to be on the lingual and buccal. Sitting the patient up at least 45-degree angle. You don't want the patient laying back when you're scanning the bite. And again, this goes for anything that you scan for. Anytime you scan a bite, crown, implants, dentures, you always want that patient sitting up at least 45 degrees. Their jaw can relax too much, and then we're not getting an accurate occlusion at the lab, and it can affect your restorations. After you take that wash impression, we talked about cleaning up that excess material, which is really important, especially let's say we're doing a copy denture. We need to be able to see the teeth, so make sure you clean up that excess material. We talked about placing the denture back in the patient's mouth. And then last, just remember, I think, denture, when you're scanning the denture 360, definitely stick to the scan strategy. When you're scanning intraorally and those edentulous ridges, you have to pivot. Every patient's a little different. Their anatomy is different. So sometimes it's a little harder to stick to that scan strategy. So hopefully some of these tips and tricks will help you be successful, but just know you have to pivot. Every patient's different, as I'm sure you all know. So I'm going to talk through this when we do the demo scan, but this is the 360 denture scanning strategy. So highly recommend, if you have not scanned a denture before, you follow this, have the PDF next to you, as long as you need until you have the scan strategy memorized in your head. You want to create a border first. You're going to go occlusal back across that post-palatal seal. We're going to fill in the palate. Then we'll scan the buccal surfaces. Same as we would intraorally. So we're going to go posterior to midline, posterior to midline. Once we have that perfect external surface of the denture, then we're going to scan the intaglio. So again, I'm going to talk through this a little bit more in depth when we get to the demo. And I'm trying to keep on time here, so apologize. Edentulous scanning. Again, this is the scan strategy, and there's a PDF for this that iTero created, and it's really wonderful. Highly recommend. The mandible is so hard to scan, especially, obviously, the ridges are usually very thin and challenging. So having somebody retract for you while you scan, coming from the anterior, dipping lingual, working your way posterior back over that retromolar pad area, and then coming around the buccal surfaces and making sure that you're kind of flaring the wand out a little bit so that we have enough tissue into that vestibular area. And then you're coming and do the same thing on the opposite side. This works really, really well. And then below you can see that the maxillary scan strategy, you want to fill that palate in first, go kind of occlusal across the alveolar ridge, and then, onto the buccal surfaces again, posterior to midline, if you're able. Sometimes it's very challenging depending on the patient and their anatomy. All right. So we're going to watch this video of a scan that I did, because then I can talk through the scan strategy, because sometimes it's very hard for me to multitask. So again, we're going to scan the occlusal first. I'm going to try to capture as much on the lingual side as I can when I'm scanning the occlusal. Then I'm going to go back across that post-palatal seal area and then connect. And then I'm going to bring the wand away from the denture, and I'm going to fill that palate in. I like to go from 8 and 9 and then fill that palate in nice and slow, following the curve of the palate here. I try not to come back too much. If I've already captured the teeth well, and I don't go back over them again, because what will happen is a lot of times you'll start to see a double set of teeth. So if I see that, I bring the scanner away from the denture, let it think for a second, and it usually figures it out, and then I can go back in and finish filling in that palate. Again, we talked about once the palate's filled in, we're going to scan the buccal surfaces. So we don't want to go straight across the buccal. I want to go do this wave motion. I'm going to go from the incisal edge up to the ridge, down to the incisal edge, back up to the ridge, and work my way back to the midline there. And I like to roll onto the incisal edges, and even on the posterior, I roll a little bit onto the occlusal so that it stitches well when I'm bringing that occlusal and buccal together. So same thing, I reposition. I'm going to come occlusal, roll to the buccal. I'm coming incisal edge up to the ridge. Right here, I rolled a little bit more onto the occlusal, so that's stitched well. Coming up to that ridge, down to the incisal edge, and working my way back to my midline there. Now, before I turn the wand off, I come away from the denture, and I'm going to spin the denture around and evaluate the external surface. I want to make sure that I have a solid occlusal and buccal surfaces. I have it all the way up to my ridge. I have the palate. once I ensure that that looks good, I'm turning the scanner off. Okay, but I'm staying in the same scan segment. I'm staying in the upper scan segment. Then I'm going to scan the intaglio surface. So if you look on the lower left side, you can kind of see my finger there. I'm going to keep that gap as I'm going and scanning around the ridges. And I'm following a similar scan pattern as I did on the external or cameo side of the denture. And I'm creating that border. Again, keeping that gap. You can see my fingers a little bit, but that's okay. It'll help you scan faster. Then I'm going to come anterior. I like to find wherever there's like a frenum attachment there, that little notch. That'll pick me up quicker. I'm filling in the anterior and I'm bringing that wand base up. And then I'm twisting. And then I'm going to fill in that palette. And the nice thing about, I turned the scanner off before I started scanning the intaglio. So if I have any sort of distortion on the intaglio surface, and I have to delete it, I'm not deleting that external side of the denture. So I'm evaluating here. I'm making sure that I'm not missing any data. And then what I'm going to do is come back to the denture and I'm going to roll to the buccal surface. And then you'll see that external side pop in, and then it'll give me that 360 scan. As soon as I see those images come together, the external and internal surfaces come together, I bring my scanner away. I'm going to evaluate the scan, make sure it came together well. I'm not missing anything. And then I can go and scan the lower arch. So while I'm scanning the lower arch, again, I'm just scanning this for the occlusion. So I'm just going to do occlusolingual buccal. You'll see me scan. But while you're watching that, some key things for the denture 360. I want to have a good border, okay, on the external surface. If I'm missing a little bit on the palatal side on that external surface, it's okay. The lab can still work with it. If I'm missing any data on the intaglio surface of the denture, again, we talked about, I've said it probably 5 times, sorry, have an edentulous scan so the lab can overlay those images. Okay, so we're filling in that missing data with accurate data. All right. So we're scanning that opposing arch, making sure that we have a solid occlusion. And then we'll go to the bite segment. Again, if this was a patient, I'm making sure the patient's sitting up at least 45 degrees. I'm putting the denture back in the patient's mouth. I'm getting position before I turn the scanner on. Ideally, first molar to canine is all you need. As soon as those arches come together, I'm turning the scanner off. Sometimes less is more. If it's not coming together, I'm going to just go up a little bit higher and a little bit lower on the tissue so that comes together. All right, I'm going to evaluate the scan again, make sure everything looks good. When you scan these cases, I'm going to continue on here. When you scan these cases and you go to post-processing, just know it takes a little bit of time because these are really large scan files. So if you haven't scanned for these before, it is normal for it to take a little while to post-process. And sometimes if there's like extra scan fragments, it usually cleans that up when you post-process the scan. So just know that too. All right, so we're wrapping up here. I just want to do some scan reviews. So again, what to look for when you are scanning, what's good, what's not good, when's the lab going to ask you for a rescan? So an immediate denture, this was a pretty decent case. I would like to see a little bit more up into the vestibular area in the anterior region. But we have the full palate there, which looks good. You can see on the mandible, I don't believe we were doing a full denture for the lower. It was just the upper for this case. But if we were to have gotten the scan and been asked to do a lower denture, it definitely would have been a rescan for the lower. We definitely need to make sure you have all the way back to the retromolar pads, excuse me, and the maxillary tuberosities on the maxillary. This is a nice copy denture scan that we received. So again, not changing anything about the external surfaces of the denture. There's a little bit of distortion there on that palate, if you can see that. So we're missing a little data, but again, not super critical because we had the intaglio surface looked great. They trimmed up on the buccal surfaces. So that would be a good copy denture scan there. This was a reference denture scan, not too many changes. You know, sometimes you have those patients where their teeth are completely worn down. Or they, you know, we need to decrease the gingival display, increase the gingival display. This we were really just shifting the midline, but they took a beautiful wash impression, marked where we needed to move that midline. And this looks pretty darn good. So that's what you want to kind of look for these cases. Let's see. All right. Videos lag a little, sorry. Here's another reference denture scan. So this one we were able to work with, again, upper right photo here. I'd like to at least have that border, so back along that post-palatal seal area. We were missing a little bit on the intaglio surface, which you couldn't see here, but they did scan, so we have that 1 and 2 option. They took a beautiful scan of the edentulous tissue as well, so we were able to work with that. So that's what it's going to look like when you toggle that denture copy scan. Here's a nice scan of the edentulous arches. So again, we would just scan those edentulous arches, upper, lower, skip the bite segment unless we're doing that putty matrix and establishing the vertical there. And then we're going to notate that to the lab. All right, so here would be a manageable scan. Now, the reason this was, if it was just as is, this would be a rescan required, okay? We're missing a lot on the intaglio surface here. We're having stitching issues on the occlusal surfaces, and we're missing some data on the occlusal surfaces. And you can see on the lower arch here on the anterior region, we didn't come back over and roll over the incisal edges. So you want to make sure that's really nice and solid. There's no distortion. We're not missing data. This case, we ended up being able to work with it actually because the doctor sent us in stone models as well that we were able to digitize, and we ended up doing a try-in and making some modifications from there. So it can be done. This one was manageable because they sent those models in as well, but not ideal. If you can really try to get a good scan, then that's really key. And practice is key too when you're scanning for these cases. If you've never scanned a denture before, reach out to us. We're happy to come and do some training and bring in a denture. You can get some hands-on and practice, and we can kind of help guide you. Or if you have a denture in the office that you can practice scanning on, highly recommend before that patient comes in. Because it can be challenging, and it's very easy to get those scan distortions. Next case, I think I have 2 more here for you guys. So this would be a rescan recommended, and here's why. The patient, they did take a wash impression. They did scan the denture 360. We are missing some on the buccal surface here, but they were requesting a copy denture. So we can't see a lot of the teeth here. So we can't really copy that denture. So again, after you take that wash impression, just take a scalpel and trim up on the buccal surfaces, and any excess material, just remove that. Again, we don't want any on the occlusal surfaces to interfere with the bite. So just make sure you trim that up, especially if you're asking the lab for a copy denture. That is really helpful for us. And then other rescan sorry guys, long day. Rescan recommended. So the right photo here, they scanned the denture 360 and the edentulous arch in the same scan segment in that upper. So we couldn't separate those files, so that was a challenge. And then the one on the left here was interesting. So this is actually overscanned. It's not that they didn't scan the intaglio surface and they didn't try to scan that denture 360. It was actually overscanned. So typically when I, work with offices who have not scanned a denture, or assistants, doctors, whoever, who have not scanned a denture before, you're scanning for probably 20 to 30 minutes for the first denture you ever scan. So that's why I say practice is key. This assistant was scanning for the very first time. I was there. We finally, the scan did come together on their scanner. They sent it to the lab, and this is what we got at the lab because it was the first time they scanned and it was overscanned. So instead of completely starting over, we were just trying to, piece it together and make it work. And this is what happened. So it doesn't happen very often. But I like to show this case because in some rare instances, if the scan looks okay, but you've been over scanning and the lab is questioning you on your scan and saying like it's really distorted, this is what it could look like on our end. So just let us know if it does look okay on your end. Sometimes iTero modeling can work some magic. Sometimes they can't, but we can certainly try. Thankfully for this case, we did scan that denture two separate times. So the other scan we could have worked with, but if we would have gotten this as is, we wouldn't have been able to proceed with this case. So those are some things that can happen when you're scanning. Again, it's a challenging workflow, but it definitely can be done. The more practice you have, you'll be scanning a denture in 2 to 3 minutes. I can guarantee it. As long as you follow those scan methods. That is a wrap. My friends are back on. Hi, Alyssa and Lauren. Thank you guys so much for being here tonight and joining us. And hopefully there was a few bits of information that'll be helpful to you to be successful. Here's my cell phone number and my email. So we're here to support you as much as we possibly can. We can come and do an office training, support virtually. I'm happy to answer any questions. I do get on frequently with offices, sometimes even FaceTiming to confirm for scans. So happy to support any way that we can. If you don't mind taking a few minutes to fill out this feedback form for us, we would really, really appreciate it.
Thank you, Emily.
Thank you.
Yeah,
And thank you, everybody, for joining us tonight. We appreciate your time.
Yes, thank you very much. And if you could just take a quick moment, pull out your phones and scan that QR, that will help us to better determine future education events that you might be interested in. Any feedback for us on what went well today, what we could have done better. We're always looking to improve. But Emily is definitely a wealth of knowledge and a great resource, and Lauren's here to support you all as well. So we appreciate your time and enjoy the rest of your evening.
Thank you.
You.